Well, let me just welcome you all. I'm glad to see you all and hope you're all well. Mark, I hope you're doing okay. I know you're having some issues, obviously. You
Yeah,
know.
I think the worst of it's over at this point.
Yeah,
And then hopefully it gets better.
yeah. Okay, I just lost your video. Oh, no, there you are. Okay, yeah.
Hi, Jeanette.
Okay, so,
Welcome.
all right, so Teresa was asking Shirley to give a little treasurer's report, and then I'll make a little pitch for the fundraising coordinator part of it. So,
Well, I didn't know I was going to do that. The book is in the other room, but we have 400 and some odd dollars, close to $500.
okay.
And we haven't collected anything for the last couple of
Well,
months.
it's a little
No
hard.
meeting, no money.
Yeah,
No meeting, no money.
yeah.
So, but we are going to turn the money over to Mike. So
Okay.
within a month, it'll be in his hands. Okay?
All right. Sounds good. And hopefully one of these days we'll get back to meeting in person and we can add to it. But in the meantime, I've been mentioning at our meetings, although we haven't had one in a long time, if you haven't already done it, consider going to the PDA website and making a donation there, maybe becoming a monthly donor, because our people at PDA and the leadership are, including Dr. Bill and Mike Fox and Dan O'Neill. I mean, they're just doing all kinds of stuff, and they're probably underpaid, and want to keep our organization going and get some money in to give them some decent salaries. So I'm not real good at fundraising, but that's my pitch. So if you're not already a sustainer and you can do it, I mean, no, these are especially difficult times now, but if you can find your way to do it, it would really be helpful.
Yeah, and you can do just $5, $10 a month.
Yeah.
And it really helps. Every little bit helps.
Yeah. Yeah.
Mike, a quick question. This is for national, right?
Yeah.
Like I've been attending Dr. Bill's healthcare emergency things and donating a fair amount each time I'm on there. Does that go to the place where you need it to go?
Well, it does, but all these organizations now, if you notice, they're asking for monthly donations. And you can do it however you want to do it, but it helps them plan their budget better and know what kind of revenues they have coming in to cover their expenses. So that's why they're all, pushing for monthly donations now.
But the money all goes into one place. There's not a separate fund for San Fernando Valley.
Exactly.
PDA.
No, this is what I'm talking about. Is when you do this, it's going to the national organization.
Okay, because I have a monthly that I do too. That's like
okay, great.
$15, but lately the people that Dr. Bill's been having on the webinars have been really inspiring.
No, that's great. I mean, if you're doing monthly and something comes up and they're asking for an additional donation, just because you're doing a monthly, again, it all depends on your finances. There's certainly nothing holding you back from making an additional donation. So, yeah. Okay.
Thanks.
So we weren't able to post the agenda. I mean, just briefly, next we're going to have Dr. Bill's presentation, and Teresa will introduce him and his subject. We may get him to extend a quick, maybe 3 to 5 minute report as part of that on the healthcare IoT and, the healthcare as a human right IoT, because he runs the monthly calls on that. I'm going to give a brief report on the letter drop to Sherman. I don't know if we've been doing anything to Cardenas. Mark, maybe at that time, could just tell us what he knows. We'll talk a little bit about some of the campaigns PDA National is doing. Then we'll talk about the CD 29 endorsement, which is Tony Cardenas district. And then I've got some things, if we have time, to update you on PDA-CA. And, maybe get your input on some of the issues. And that's kind of where we're at. So at this point, I guess, Teresa, I think most people know Dr. Bill. You know, he's our stalwart advocate for Medicare for All, and he's doing a great job, and hopefully we're getting closer. So Teresa, I'll turn it over to you and let you introduce him, and then let him make his presentation.
All right. I also wanted to say welcome. We've got a few new people here today, and that's great.
Yeah.
So Dr. Bill is the lead outreach for the National PDA, and also the head of the healthcare IoT issues oriented. I always forget.
Organizing.
Organizing. I always want to say orienting team. And does 2 times a week calls now on COVID-19 and healthcare. And we want him to address those. Hopefully we can get Medicare for All. People are really talking about it now. So, Dr. Bill, do you want to show something on your computer? I
Yes.
think Mike Dollar is still the host, but if he could let you be the host.
We'll see what happens.
Mike, can you hear me?
Yes, he made me the host.
Yeah, it says he's the host now.
Right.
Oh. See if it
So,
works.
yeah, great. Thank you. Thanks, Teresa. Thanks, Mike and Mike. Appreciate it. Great to see all of you. Also, my friend Danette, who's a fellow Orange County activist, and
Hi, Danette.
yeah,
Hello, good evening.
Hey.
she's kind of jumping into PDA. We've been doing the climate strikes together for a year now at
Yeah.
our local city hall, Orange City Hall, in the beautiful city of Orange, California. And so since the pandemic, we're all being shut in now. She said, "Hey, what can I do with PDA?" And so we've got Danette jumping in here and doing all these terrific Zoom meetings and things. We have been, on the occasion of the COVID-19 healthcare emergency, we decided to go from monthly meetings to twice a week. That's quite an increase in the number of healthcare team meetings for PDA. But I don't think we could have a better excuse for stepping up than this current healthcare really catastrophe. I mean, we think of catastrophic events like wars and maybe nuclear war or climate, but a pandemic, that really is a healthcare catastrophe, right? So it dawned on a lot of us who've been working on the idea of Medicare for All for a number of years now that we should be talking about how Medicare for All would have better prepared us for this pandemic and will better prepare us for the next pandemic, because climate scientists tell us that as global temperatures rise, then new germs will be released, right? New bacteria, new viruses, new pathogens. That's why they call it the novel coronavirus, is because it's new. And that's why we know so little about it in terms of testing. What does the testing mean? How do we track these things? And we've had to go back to the most basic kind of public health measures like quarantine. So, I don't know about you guys, but I think of like Albert Camus' The Plague, when I think of quarantining people and putting folks in isolation and trying to keep the spread of disease under containment, right? So how old is that concept? I'm sure it goes all the way back to the original Black Death kind of concept where people recognize that, hey, if I'm around someone else who's sick, I'm going to be sick too. So, so that's, unfortunately, that's the state we're in with this, these new germs, and there's more coming our way. And so we've been looking at Medicare for All, all of us here in this virtual meeting room have been looking at it as, hey, if we had a real public health system that was controlled by the public, by we the people, wouldn't we be responding better to it? So that's kind of with all the news that comes out with Gavin Newsom's daily reports and Mayor Garcetti's daily reports and things, we figured we could step this up to once or twice a week. So we started it twice a week, every Sunday and Wednesday. We're just now cutting back a little as they're going to, stage 2 of the quarantine now, which is, I guess we're in phase 1 of stage 2 or something like that, where they're starting to reopen some businesses for curbside kind of retail outlets. And so we're stepping back a little bit. We're going to once a week now. So every Sunday, 1 o'clock our time, we're doing these emergency online town hall meetings. And that's where Mark Zamoski's been with us, I think, for all these now too. Thank you, Mark, and contributing. We really appreciate that too. Your contribution, by the way, is going to us having, keeping up our database, our website, being able to communicate, spread the word the way we are. So, Mike Thaler is doing amazing work as the president of PDA-CA, PDA California. Thank you, Mike Thaler. Thanks for hosting this too. And Mike Goldman is involved with that. And Teresa has been on recently with the PDA-CA leadership meetings now. We're on Zoom with that too. So we actually, on our healthcare team, we've been on Zoom for about a year now. So way before the pandemic started, we started communicating online in this video format, which is really nice way because it's more like a conversation rather than just talking on a phone and you can't really see people and interact, see their expressions and things. So so we're quite familiar with Zoom. And but anyhow, I was gonna kind of go over with you guys and see what you think about this. Some of the basics for regarding the pandemic and Medicare for All, because I don't know if you've noticed, a lot of our leaders, it's not just Tony Cardenas, it's a lot of even folks that we think are champions usually are not talking about Medicare for All, right? They're talking about getting relief for your mortgage and rent relief. They're talking about paycheck relief. They're talking about utilities and even food, housing, student debt relief. Bernie and Pramila are talking about healthcare relief. That's what their proposed bill is. They haven't introduced it yet, but it's called the Healthcare Emergency Guarantee Act. We're still looking for original co-sponsors before they formally introduce that into Congress. So I'll go over that with you toward the end here as well. But I wanted to kind of share with you kind of my thoughts about the pandemic and and the interface with Medicare for All, because you're just not hearing it very much out there unless you really look for it, or unless Bernie says it, or maybe Ro Khanna says it. Unfortunately, there's a real kind of, I don't know, quiet coming from our national leaders on the subject, and almost as if big pharma and big insurance shut down the conversation before it even started. So so I'm going to share with you a PowerPoint that I've given, and since actually our very first meeting. Can you guys see that?
Yeah, it worked.
Yes.
Yes. Great. So so we've been doing this PowerPoint discussion since our very first session. I think we're coming up on session number 15 of these emergency online town hall meetings. But I've kind of updated a few things here. but I call it policy and politics. So what are the policies around healthcare, okay, that relate to the pandemic? And what are the politics of that? So let me show you a couple of basic things here. First of all, Dr. King said, injustice anywhere is a threat to justice everywhere, right? Couldn't be more true in the case of a pandemic and an infectious agent like we're looking at. I mean, the virus knows from no borders, no classes, no races. The virus will attack, anyone, anywhere. So it's a healthcare injustice anywhere becomes a healthcare injustice everywhere, quite literally in this situation. So let's look at some of the elements of healthcare policy that would relate to this. And I've kind of isolated three main ones. What are our resources to deal with the problem? How do we get the money to deal with the problem? And then how do we prioritize those things to get them to where they're needed, right? So if you look at resources, those are the usual things that you think of, and being I forgot to mention that I'm a retired emergency room physician. So I've practiced for over 30 years here in Southern California, and so as a doctor, I was looking at this thing like, whoa, are we going to have enough doctors? And if we hadn't flattened the curve, right, then we were looking at needing more personnel, more equipment, more facilities, more drugs and supplies, all of that. But we flattened the curve, so we didn't need as much at one time. But that kind of thing has to be, decided on. Like, what are the resources that we need? Personnel, facilities. Do we have enough intensive care units? Emergency room capacity. You've seen these little tents that they've set up out in front of hospitals now for triaging. That's a good thing. And then, the big one, I think the really big one is drugs and supplies. And included in that are the test kit. My representative is Katie Porter, the fabulous Katie Porter. She has signed on to Medicare for All. She was one of the first people to demand that the government, provide testing that's free to everyone, free access and no cost whatsoever at the point of service. Has that happened yet? No. Thank you very much. Federal government, state government, local government. I heard today a presentation by the city of Irvine that said that they're now starting a program where they are going to have, for anyone who resides in their city, can do like a drive-through testing center that they're going to have. But you're going to have to prove that you're an Irvine city resident, even. That is not universal. That's not everybody getting all the care. That's just one mostly suburban community here in Southern California. But, is that happening all over? I heard Mayor Garcetti at one point said everybody in Los Angeles that we would have the capacity to test everybody in the city of Los Angeles. I haven't seen that or heard of it happening at this point. I think most of us feel like the test is not available, or it's extremely expensive, or but clearly it's needed, right? And we'll go through some of that here in just a minute in terms of the politics. But besides the testing and tracking, there's also various things that are needed for treatment. Ultimately a vaccine, supportive treatment, preventive, all of those things. That we need resources. The equipment, the PPE, personal protective equipment, right? So that's under drugs, supplies, medical equipment. Those are the resources that are needed, okay? How do we find the money for those things? Well, generally there's public and private sources for funding. So, the public sources, you think of public agencies. So healthcare agencies, local governmental agencies, whether it's cities, county, state, or federal. And who usually decides then, how they allocate resources? unfortunately, it's oftentimes at the whim or disposal of elected officials who, you know, like say, if you look at the federal government, it's Donald Trump and an amazing, a stunning array of corrupt people that he has, you know, appointed to various offices.
Bill,
Yeah.
can you mute Shirley?
Okay.
Oh,
Maybe you can mute everybody except yourself.
that's true.
Okay, bye.
Okay. I think she just hung up.
Got a telephone call, that's all. I had to answer the phone. I had to
Okay,
answer the
thanks.
phone. I'm not going anywhere.
Good, good.
Okay,
Thanks.
sorry.
We're just
I
trying to
Alright.
figure out how to mute everybody.
Yeah. So I was just going to over like, you know, sources of funding, public and private. You know, we have some bad actors in on the public side, but mostly it's things like, you know, experts and academics and advocates, you know, people like, you know, Dr. Fauci, right? Like people who understand and get what it is, the CDC, you know, they understand where these things need to go to. But, you know, you also have some bad actors, you know, especially in terms of elected officials. That's even worse in the private sector. So when it is public and private, then it's all market-based, it's shareholders, CEOs, all of those things come into play. And then we really don't know, is someone trying to profit off of this, you know, pandemic that's literally killing people? And the answer is absolutely, of course they are. And you don't have to look further than Donald Trump, you know, and the fact that they've suppressed so much information. So, you know, I would say a poster child for that concept is would be Mike Pence. Mike Pence, whenever he talks about, you know, how they're going to handle, how they're going to attack this problem, he uses the phrase public-private partnership. You know that phrase, public-private partnership, where there's this idea that the private sector is going to jump in and bail out the public, you know, with funding and, you know, supplying resources and all that stuff. What we might think of whenever they say that is the term, you know, privatization, which means what? Profitization, right? So somebody is making a profit. Whenever you hear public-private partnership, somebody's profiting off of that. So I would keep that in mind as we move ahead. Finally, prioritize it. How do we get those things, those resources and the funding behind it to the areas that are needed? And traditionally, we don't do a good job in this country, right? So that's why we have both underserved and overserved communities. Okay, so we've got, you know, what we call healthcare deserts, the rural areas we know they were closing down hospitals before the pandemic. It's even worse now because they're so strapped, have such few resources and that kind of thing. So when the pandemic hit, say, New York City, and was so awful, it was because a lot of the areas within New York City had poor resources to begin with, given, you know, that they were especially poor or working class neighborhoods. So that's very inner city is a healthcare desert, as well as rural areas are healthcare deserts. So you might, you know, once it started in the city where they had population density dynamics, now it's rolled out to the rural areas where you have, like, say, meat packing houses and that kind of thing. They're even less prepared to deal with and have fewer resources, healthcare resources to deal with the problem. So we want an entity that makes these decisions, that prioritizes, you know, based on those needs, not based on, like, say, you know, market share or some other kind of corporate dynamic. When you look across the country, you can see areas that were predicted even. This slide's kind of old already. I think the 2018 analysis where they decided what would the risks be in a pandemic based on population density as well as the availability of resources. And you can see, you know, that we weren't as bad perhaps in California as some other areas. You can see like you know, a lot of the red states were like way more apt to even have serious outcomes related to this because of their lack of resources, and considering that they were healthcare deserts and ill prepared to deal with it. And so this is now, clearly kind of blending from the policy into the politics, where now we've got, obvious problems with the healthcare mess that we have in this country compared to other countries. I'll show you here in a minute. But think about it too, like we've determined that healthcare should go to people who are means tested or age tested, right? So if you're 65, I mean, how many people are can't wait until they turn 65 so they can have Medicare, right? So that's what we're talking about here is, will they get the care that they need for the pandemic based on age, or, if they're below a certain level in terms of poverty, or it's private. The problem is on the private side, it's corporate and market-based, and where your health, your life is commoditized. When you look at other countries, you can see, we're probably the worst actor compared to all of these countries where we've had more incidents. Now we know it's something like, I think we have like 5% of the population in the United States, and yet we have like a third of the entire number of people infected with COVID-19. And look how we responded so poorly. This is the number of tests that were done, per million of the population in this country compared to South Korea. Okay, they were doing so much more testing, and have per billion people, such a better outcome than we have. Here's another slide that shows that. They were testing on the order of 20,000 people a day when it first hit them. We hadn't tested more than 10,000 people in a whole 2 months. So we did half as much as they did in one day over a period of 2 months in South Korea. So it's no wonder to me why they have such better outcomes and doing so much better. Let's see if I can find where that's coming from. If everyone could mute their audio, that'd be great. Until we're done, until I'm done talking. Thanks. So again, we're looking at the politics here. We've got big insurance and big pharma getting in there and messing up the works. We can't make reasonable decisions on allocation, on priorities, allocation, of resources, because big insurance and big pharma, are dictating that, not us. You've got the public-private partnership. Again, it ought to be a red flag whenever you hear it. Think profitization, privatization and profitization. And even before the pandemic, we had these prior policies that resulted in cutbacks to public medical and other services, jobs, shelter, obviously our homeless situation, that all affected what they call social determinants of health that make it so, so when you think of, for example, the impact that COVID-19 has had on our communities of color, especially Latinos and African Americans, just think of these social determinants of health, how much of these things those communities, were already deprived of, and then stressed even further in a pandemic situation. You don't have to think any further than that as to why, Latinos and African Americans have been so adversely affected. And that's basically because we have wellness for the wealthy. The vulnerable populations, the unemployed, the unhoused, people live in squalor, basically, of course, are getting hurt worse by this. And that's where you need a system that basically provides for everyone. I mean, if we say Medicare for all, we know that would do that. That would create an even playing ground. What's the word I'm looking for? Playing field. We have an uneven playing field in this country, so that people who live in these situations are challenged even further and ending up with worse outcomes as a result. And then the fact that global warming is going to create more of these novel viruses and other contagions, and we're not prepared to do something about it. So, so what does that amount to then? It amounts to us doing these few things, and most of us have been working on at least the top two for some time. So we've got our Medicare for All Act. We only have 118 co-sponsors, and only I'm saying that kind of facetiously because usually all you need is 100, and it'll go through the committee process and get voted on the House floor. But for some reason, they're holding this bill, Medicare for All bill, to a higher standard. So we need even more co-sponsors, and that includes Tony Cardenas. That includes here in Orange County, Luke Correa. I mean, why are folks who do represent a lot of working people, working class people, and even the poor and working poor not signing on to this? It's still that influence of big insurance and big pharma. The other bill is HR 5010. That's the state-based universal health care bill. That one would circumvent the White House altogether, and the the Cabinet Department of Health and Human Services. So all those Trump cronies that he has in there that could block any state's effort to have their own universal health care system. And that was one of the big arguments that was used against us last time we tried to pass it in Sacramento. Was that the federal government will never let us have this. So this bill, HR 5010, circumvents any kind of authorization from the administration. And this is actually not a new bill either. I mean, just like our Medicare for All Act had been it was put forward in the last, I think, 7 sessions of Congress. This one, the State-Based Universal Healthcare Act, had been put forward in the last at least 2 or 3 sessions of Congress, and now we're having trouble getting more co-sponsors on that bill as well. So that's something we need to work on from our members of Congress as well. The newest, kind of latest, greatest is this Healthcare Emergency Guarantee Act. Doesn't have a number yet because it has not been formally introduced. We're still looking for what we call original co-sponsors. It's Bernie Sanders on the Senate side, Pramila Jayapal on the House side. This one is very, I think it's a wonderful piece of legislation that provides healthcare relief, just like rent and mortgage relief, just like student debt relief. This one automatically enrolls anyone who doesn't have healthcare, meaning all of the uninsured are automatically enrolled into Medicare for the period of time of the pandemic. So most of us would agree that when a vaccine is widely available, that will end the pandemic, right? So this is a pandemic relief bill. It's not Medicare for all, but it acts like Medicare for all because it not only gives all the uninsured Medicare, it also pays for the underinsured. So if you have deductibles, co-pays, any out-of-pocket expenses, no surprise bills or what they call balance billing from doctors and hospitals to patients, it doesn't go to patients anymore, it goes to Medicare. Medicare will pay all of those bills that are not currently paid with whatever plan you have, whether that's Medicare Advantage or an employer-based plan. So at least all those plans in place, it's not as efficient as a single-payer Medicare for all, system would be. And so, but it is the first step in that everybody's healthcare bills will get paid, including all COVID-19 treatment like testing and tracking and the vaccine as soon as it's available. So, so that is most of the way, I would say, to Medicare for all. If somebody wanted to say, you know, what's a good step toward Medicare for all, it would be this bill, this Healthcare Emergency Guarantee Act. And we need everyone to call their member of Congress. I think there's only 8 original co-sponsors so far. And so we need a whole lot more members of Congress on that bill. And the other thing we're doing, that PDA is doing, is to get Medicare for all in the 2020 Democratic platform. So you can call the DNC, the Democratic National Committee, you can call their office in Washington and tell them that. We have a petition, PDA has a petition that you can sign that gets Medicare for all in the 2020 Democratic platform that will come out of this convention that will be held this summer in some shape or form. No one's exactly sure what. I have my doubts that it's going to take place in Milwaukee. It may start in somebody's home in Milwaukee, probably end up on Zoom just like this. But that's kind of the to-do list. And then finally, I would just say, you know, like Dr. King said, all the forms of inequality and justice in healthcare is the most shocking and inhumane. This is an international crisis, and it's an international shame for this country in the way that we've responded. And, you know, for those basic reasons that we just went over, that's why we need Medicare for all, so that we're no longer part of the problem. You know, we can be part of the solution instead of being both reactive, but especially by being proactive regarding this kind of thing. So with that, I will unshare and happy to take comments or questions about any of that.
Dr. Bell, I have a few, a couple.
Sure.
Do you know where we can find out the 8 co-sponsors on the Emergency Guarantee Act?
Now that's a great
So we know-
question. I could try and find it in my email. So if somebody wants to contact me, Dr. Bill at pdamerica.org, DRBILL at pdamerica.org. I'm happy to send that to you. I think that's the only place I've seen it, Teresa. So usually, my understanding, I've never been a lobbyist, so I don't know how it's done exactly, but my understanding is that, you know, Bernie and Pramilla's offices are contacting every member of Congress that they think would sign on to this. And they also want citizens like us to push our members of Congress, both on the Senate side and the House side, to contact their office to become an original co-sponsor. So let's say, you know, enough PDA folks from, you know, from the San Fernando Valley, you know, called Tony Cardenas's office on a particular day, hint, hint, meaning like our letter drop day, right?
Or Brad Sherman.
Right, and Brad Sherman. You know, that they would, you know, at least commit to you that they would contact Pramila Jayapal's office to see about that piece of legislation, whether they could lead on it. For members of Congress, I know it's funny because I you know, I embedded myself in the Katie Porter campaign when, you know, when she was running here. And so I tried to be like a resource, you know, to her and her campaign, and even now her congressional district office. But they don't generally come to me. It's still one way. I have to go to them all the time. And so, you know, I'm pushing, almost never hear back. But every once in a while you hear back, you know, a little something that you actually, you know, made a difference. So I'm hoping any time that they'll respond to me out of her office. But, you know, as many of us that can do it, the better to you know, to get them to see that they need to sign on. She has signed on, Katie Porter signed on to Medicare for All. Yay. We made sure of that, you know, kind of during the campaigning, that she was going to stick with it, because some of them didn't. They promised it and, you know, and then ran away from it after they got elected. So, or during the general election, that's usually what happens after the primaries. But she is not signed on to the state-based universal health care bill yet. You know, as much as I've tried to push her, she's not signing on to climate stuff, you know, or the Green New Deal or the climate emergency bill, because she's afraid that Alexandria Ocasio-Cortez, you know, being the author, is going to, you know, give her opponent kind of more traction to say, see, she's associated with that squad, you know. So it you know, it really is a squeaky wheel gets the oil situation, I think. And we got to do a whole lot of squeaking to make them realize that that's what we want. That's what the people want.
And I hear that in the next CARES package that they're trying to get through, that they've got money for the lobbyists who are fighting Medicare for all.
Oh my God.
Yeah, I don't doubt that. So there's a real nice one-page flyer I could, you know, I could share with you. I could post here as soon as I can go to my web browser. But it's from PNHP. It explains the difference. You probably have heard of this COBRA relief bill.
Right.
So COBRA is the system. I have no idea what it stands for, but it's a system where you can extend, I think it's continuation of something.
Yeah, it's over $1,000 a month.
Yeah. So if you leave your job or you get fired or, you know, whatever reason you lose your employer-based insurance, you can buy a new policy at you know, a supposedly reduced rate from what it would cost you to buy as an individual. So you can buy a group policy or extend your group policy after you've left your place of employment. So what I think Nancy Pelosi and, you know, the corporate Dems are pushing that as a solution to the problem for so many people who've lost their insurance because they lost their job. But a lot of people lost their job and didn't have insurance through their employer to begin with, you know. So that's a problem. They were completely uninsured. So this COBRA bill doesn't cover anyone who's uninsured. And like you said, COBRA is fantastically, not only is it expensive, but it has a lot of co-pays, deductibles, in-network, out-of-network expenses, surprise billing. All of that is still in there. So what most people are saying is that COBRA relief bill is actually just giving money to private insurance companies, you know, and obviously the lobbyists who work for them. Now, Pramila Jayapal has another bill with Joe Kennedy that is a healthcare relief bill, and that one actually does it would enroll people in Medicare who lost their job. So that is a true, you know, health insurance relief bill, but it doesn't go as far as the Emergency Guarantee Act, where it actually covers all the uninsured people.
Right.
Too. You have to qualify for that by being someone who qualifies, say, for unemployment insurance, and that would qualify you for Medicare. But what about all the other people? You know, so that's a lot more people that it would pick up.
I wanted to make a couple points that, in terms of your presentation, and just wanted to mention that public-private partnership. Someone needs to move.
Is that
Where the public-private. I believe that's Clinton's third way. I think that actually kind of originated with Bill Clinton, and that's one of the key components of all these neoliberal policies that we have is this public-private partnership that leads to privatization, which is just, you know, like you said, leads to profitization. So that's good. And another thing, you know, you talked about getting Medicare for all on the platform. That's one of the reasons that PDA is still pushing to have the primaries and have people vote for Bernie, because if we can, they feel that if Bernie can get 25% of the delegates, even though he may not get the nomination, it'll give him more leverage on the platform committee. So you should keep that in mind, and I'll mention a little bit more about that later on. And one other thing, I don't know whether I don't think you mentioned this particular bill, Tammy Duckworth and Bobby Scott's bill, HR 6139, which is a bill that requires the Department of Labor to promulgate emergency standards to protect our, healthcare professionals. So just wanted to kind of add that in to make those points.
Yeah, 2 points there. Thanks, Mike. One is that, the nurses, National Nurses United, have been such stalwarts, such terrific partners in the struggle, and along with Physicians for National Health Program. I mean, then we couldn't have better, more worthy champions in this fight, than the nurses. And I don't know if any of you were in the candlelight. They had a Zoom candlelight vigil the other night, and they read off names of nurses who have died, and due to
terrible.
COVID-19. And in Canada, it seems fantastic, even like almost surreal, but they've had no nurses die. 0 have died, and they have had COVID-19 cases. And that would be like saying nobody from California, that we haven't lost a single nurse yet, and that's not true. I heard a number of nurses from California, but they're about the same population size. So you want to compare, roughly equal population size. But obviously, they're so much better prepared to deal with this healthcare crisis, in a single-payer country like Canada or Taiwan or South Korea, and that's why. The other thing I would bring up too is, and the nurses, that is one of the first bills they brought up. They asked us to promote was the Healthcare Protection for Healthcare Workers Act, and so we, I don't know if that bill has been. I don't think it's been voted on. I mean, most of the actual business of the House has been held in suspension until they can have more kind of orderly meetings. But they've come together to pass these CARES acts now, as you know. So, but that's certainly of extreme importance. And I would expand that now to include all essential workers. I mean, who isn't at risk, who's out there like say working at a grocery store, handing groceries to people, that kind of thing. They're absolutely police and fire and paramedics and all kinds of essential workers are out there on the front line, protecting us in the process. So they also need hazardous duty pay, so and they should be getting that. And I know a lot of employers are threatening to cut that off if they already, provide it. And of course,
Are you raising your hand, Shirley?
No, that's my
okay.
Her cat.
Poor cat.
It's an intervention. Yeah, we saw the whiskers.
Okay.
But the other thing I was going to mention was our own Russell Green, who I know has been fighting. He thought maybe he had COVID-19, so he's been fighting that for weeks now.
Who?
Russell
Green.
Russell?
Yeah,
Russell Green?
Yeah. Shoot him a
Did he have a
message.
test?
Yeah, so it's a long story, but he was the champion. I want to recognize that he was the champion in 2016 who got climate emergency in the DNC platform. So when you and I go to Cardenas or Katie Porter or whoever, and tell them that they should be on board with that climate emergency resolution, and they resist, we can say, it's in the 2016 platform, the national platform, and you're resisting that, So it is political capital, as they say, and that's why it's so important, like you said, to get more Bernie delegates that will be able to push that. You know, as you saw probably yesterday, I think was the news that that Biden and Sanders have agreed on a team, what they're calling a unity team of some kind that includes Pramila Jayapal and AOC and other good people, to sit down and iron a lot of this out. So it is really important, and that's why we're still pushing. There's what, something like 20 states still that have primaries. I mean, that's a lot of states, and people should be able to express their wishes in a primary, you know, and not be bullied like apparently some state parties, not to mention names, but New York,
California.
would try to push people out. So there's no consent.
Well, I was wondering if anyone else had any more questions or comments, because I wanted to move on, but if we could take a couple more questions.
Absolutely.
Mm.
Anyone have anything? Okay.
No?
All right.
I am looking for how to make Mike the host. That's a problem. Mike Feller needs to be the host again, but all I'm given is like rename or edit profile picture. That doesn't sound like host functions to me.
No,
Because
go on my little square and hit the ellipse, and it's.
Oh, that's the way you do it.
Yep.
Cool.
Okay.
Make host. There it is.
Mike,
Who's doing that?
it's Carrie. Turn your volume down.
Okay, and thank you so much, Dr. Bill. That was great.
Yeah, we really appreciate it.
You're so welcome.
Always appreciate and thank you for all your activism.
Before
Thank
you go,
Because, some of us don't have the time to really get involved as much as we want to, and you're just really picking up the mantle. We appreciate it.
I don't hear you.
I think
Hello.
Just saying.
Carrie
Hi.
had something too.
before you go away, Alyssa has a question.
Sure.
Oh, okay.
Actually,
You're muted, Alyssa. Unmute yourself.
Maybe she's on. Carrie just muted himself. Let's see if we can. Yeah, you have to unmute yourself, Alyssa. You're still
Here.
muted.
In the lower
Carrie.
left-hand corner.
Whoever Zoom it is. Because Alyssa's video looks like it's frozen. How about
Yeah.
Carrie? Carrie, you could unmute yourself. Or Mike Feller could unmute you. While we're waiting for Carrie and Alyssa, I will just remind folks that I did put in the chat. You can, the information for our next emergency town hall, healthcare emergency town hall. It's this Sunday, 1 o'clock Pacific time. Go to the Facebook event page for PDA Healthcare, or you can email me. I'll get you in.
Yeah.
There's Carrie. You're back again.
Can you hear me?
Yes, we can.
Okay, here's Alyssa.
Okay.
Hooray.
okay. Hi. So I
Hi.
couldn't hear. All right. Hi. I just wanted to say I was trying to get in. I know you mentioned National Nurses United. That's not the only nurses association. You and I have talked about it.
Absolutely.
I'm part of American Nurses Association and ANA California and a number of nursing ethics groups who are doing a lot of work on this. Not just looking at, protective equipment, but also looking at the ethical aspects of it, the mental health support for people.
Yes.
There are ongoing webinars. If anyone's interested, I can send you some links to those. But just to remind you, because sometimes you say the nurses, and it's not
Right.
just National Nurses United.
No, thank you
Okay,
for that.
so there's many of us here, and many of us have lost friends as well.
Thank
So,
you.
Very sad.
I
Thank
would-
you.
Alyssa, if you could send me that information on the webinars, I would love to get on ANA webinars. And
Okay.
and I know another solid coalition partner of ours is NUHW, National Union of Healthcare Workers, and that includes a lot of mental health workers and even clerical people. So, you know, and they've been, you know, they're so entrenched in the they're in survival mode. So they've had a hard time looking outside, you know, that you know, the personal protective equipment, you know, all of that, all of those issues. I tell you, it breaks my heart every time I see a photograph of they're asking nurses to reuse their masks. I mean, that is just, it's obscene. I mean, it's almost like, it reminds me of the old days of before, you know, we figured out what was causing AIDS, and we're starting to hear that people in sex workers and stuff were, and they were continuing this activity knowing that people were going to die from this. So, I mean, you cannot reuse personal protective equipment, you know, in a healthcare setting. Hospitals need to provide that. They're supposed to provide it for every contact, every patient, not just once a day even. And here they are asking them to put it in a paper bag. Have you seen that photograph? They have like a bunch of paper bags on the wall. They're supposed to put their N95 mask into the paper bag and reuse it the next. That is just obscene. That just sets my hair. If I had hair, it would set my hair on fire. So, you know, that's what we're up against right now. That's corporate healthcare in America. Thank you, Alyssa.
Okay,
Appreciate it.
yeah, thank you both.
Oh, Dr. Bill, will you stay around for a minute?
Yeah,
Well,
I
I'd
can
like
say
to,
Yeah.
I'd like to move on if we could.
Oh, was he going to talk about the IoT?
Well, was there anything more that you really had to add other than the fact that you have the, you know, on the IoTs, you know, you have the monthly calls in addition to your COVID-19? Is there anything, you know, what's going on with the IoT on the healthcare as a human right?
Yeah, so let me just say that we do have a kind of a leadership part of the IoT of the team. So that includes the people that I'm sure you might think of, like Alan Minsky and Donna Smith, you know, myself. But we also have a broader, what Tim Carpenter always liked to call the kitchen cabinet. So we've got a kitchen cabinet with some healthcare people who you might know, like Nurse Judy, who was originally from Orange County. She lives out in Emmett now after she retired. Another nurse, retired nurse, Ken Kennegas in the Phoenix area. So, and then my friend Henry Broska, who's a health systems expert, analyst. And he's from Orange County. So we have a little broader, like, kitchen cabinet. We're always looking for ideas if folks have them for, we've had a number of local leaders. For example, just this last time we had a friend of mine who's on the city council for the city of Anaheim. And he talked about the challenge in his city in particular, because it's like 80% Latino. So he was talking about the pandemic and how Medicare for all would benefit, you know, a city, you know, near and dear to us, like Anaheim. So if you know somebody who might be good to have, and, you know, we can feature in a guest spot who would like to, you know, to speak for 10, 15 minutes or so on a particular subject, you know, Alyssa, you'd be great for it. Or if you want to just join be part of that kitchen cabinet, I'm happy to include you in the planning emails. Mark, maybe you'd like to be in the planning emails that we do for our town hall. Just let me know.
Yeah,
and everybody knows how to reach me, I'm sure.
Yeah, I think that the idea is still also that each of the chapters are supposed to have a liaison that's from their chapter that's supposed to be on the call and then report back to the chapter. Mark, I think we got you involved with that, and I think that you're kind of our IoT chapter, our healthcare as a human right chapter liaison.
Okay.
So
Yeah.
I don't know if you've been able to make the calls or not, but that was something that we had talked about. I don't know whether you officially signed up or not.
Mark's a regular.
Is he? Okay, good.
He's been on
Good.
all of them. Yeah.
All right,
I said,
great. Yeah,
yeah.
because he's really doing a lot of stuff here locally, not only with PDA, but with other groups as well. So that's
Yeah, I'm happy to loop you in, Mark, if you wanted to. I can loop you into our planning emails, and so if you
That
have.
would be great, Dr. Bill.
Oh, thank you, thank you.
all right. Well,
Thanks, Dr. Bill.
yeah.
Thank
you
you.
very much. Yeah.
Thank you.
Thank you. Very
Oh,
nice.
thank you guys. Great to see you. Thanks. Let me know if you have any questions on any of this stuff.
Okay.
Caller.
All right. So the next thing I had was the Educate Congress letter. We haven't done one for May yet. I did present the April one to John Alford at Congressman Sherman's office. And Sherman, the contents were the Healthcare Emergency Guarantee Act, which Dr. Bill mentioned. And I'd be curious. I don't think he has co-sponsored it. I don't think he's one of the original co-sponsors. Obviously, we asked that he do it, and I haven't really followed up on it. So maybe I'll do that and have him contact Congresswoman Jayapal's office. One of the other bills was, and this has both a Senate and a House version, and Feinstein is on the Senate version, and Sherman is on the House version, and that's HR. That's the one that I mentioned about protecting our healthcare workers.
Oh, good.
HR 6139 and Senate 3475. So Sherman is on that one.
And Harris isn't? Or we don't-
No, I checked today and he's not on it. So any of these bills, if
No, Harris, Kamala.
Kamala, you can call their office and ask them to co-sponsor these bills.
And it's 6139?
Yeah, 6139, which Sherman is on, and then Senate 3475. And I don't want to take the time to go into a lot of detail on it, but if you go to congress.gov or I think govtrack.us, you can look up the bills and get a quick summary of them and see who the co-sponsors are. And then, contact the offices of the MOCs. There was also a bill on the student debt crisis. As you know, that's a big national campaign of PDAs is student debt forgiveness, and especially pushed by Alan Minsky. He's really, really big on that one. And the bill that we were asking for co-sponsorship was just, there was no Senate bill, just a House bill to provide $10,000, right now, just providing $10,000 of emergency student debt relief to help
Yes, I know.
people with student debt. And that's HR 6379. So if you want to look that up and contact Sherman's office and Feinstein and Harris's office, you can do that. I've been concentrating on Sherman. As you know, we're not really dropping anything from our chapter to Harris or to Feinstein. Some of the other chapters might be, but we've been mainly concentrating on Sherman, and to the extent that we could, Cardenas, but it's very frustrating, as you know, with Cardenas. And there was also HR 92 and Senate Bill 26, which are bills to guarantee a safe election by allowing the states to do vote by mail with limited conditions, so that it would be easy for the states to do vote by mail, and that the ballots should be delivered by the post office, because it kind of dovetails into the campaign It's been going on for 30 years now, and now is, you know, it ramped up when they passed the draconian pension funding bill during the Bush administration. Now Trump is trying to eliminate funding for the post office. So these are just measures that are continuing to push to use bankruptcy of the post office as a reason to privatize it. And then now has additional significance because we need the office to, you know, to deliver the mail-in ballots. So PDA has been working on that, and this is a bill to make it easier for the states and harder for the federal government to.
What's the number again?
It's Senate 26 and HR 92.
Thank you.
Okay, and Feinstein and Harris are both on that one, so that's good. So if we could at least get Sherman on it, that would be great. I mean, I think it's doable with Sherman. He just needs to be pushed.
Yeah. No, that
And-
shouldn't be a bad. He should be
Yeah.
able to come onto it right away.
Yeah, and I didn't see
Probably just doesn't know.
Card. I'm sorry, go on. I interrupted.
Probably
you.
just doesn't know about it.
Yeah,
That's one of his kind of bills, so
Yeah.
he'd be fine on it.
I'll try to call John Alford and mention it to him again, especially that health. Well, it's really the vote by mail one is real, and the post office one are really important to me personally. I mean, the other ones are also, but I think that that's a real concern. Another nail in the coffin of what we have left of our democracy is the post office thing.
Yeah.
And Danette, did you want to say something? No? Okay. All right.
No, I was just concurring with you. That is really frightening. The whole post office trying to kill them
Yeah.
off. Very scary.
And there's all kinds of petitions now on the post office. So I'd urge you all to sign them if you can. I don't know what good they do, but they're certainly better than nothing. And if they ask for follow-up calls, I think the calls are more effective.
Yeah.
And as far as the letter and cardness, like I said, he's not on any of those bills. Mark, do you know if the letter was taken to Cardness' office, if Robin did it, or if you did it, or if Kat did it?
Which
That
letter?
was the April bill that covered these particular bills. The April letter that covered these items.
Well, I emailed his office with because we're in shelter in place.
Oh, that's right.
Well, that's what I did also. Yeah. Yeah. When I say delivered, I did it by email also. Yeah. I'm sorry. So you did deliver it to Cardness' office?
Yeah. And surprise of all surprises, I got no response back.
Yeah. Well, maybe we'll do something about that. I don't know.
Well, I have an idea
And think
about
it.
an endorsement.
Yeah. Yeah. Well, we're getting to that.
Okay.
Yeah. And, you should all be getting PDA's emails and, following their action items. And, 3 of the more significant ones are like I mentioned, was the student debt forgiveness and the post office and vote by mail campaign. And, PDA partners with and forms alliances with other organizations that are working on these issues to give it, more leverage and more clout. And then I mentioned about the platform and the Bernie delegate, because a lot of people have, look at Biden's going to be the nominee. What's the point of pushing the primaries? But like I said, the purpose of it is to get Bernie to accumulate 25% of the delegates and to have some clout on the platform committee, not only on Medicare for all, but on the Green New Deal and doing something about the climate emergency, keeping that platform plank that, Russell helped get in 2016. So you can see that PDA has been at the national level with getting Bernie to run, being on the platform committee. Dr. Bill was also a Bernie delegate and, has been pushing, to me, 2 of the very most important long-term critical issue, domestic issues are Medicare for All and the Green New and the climate emergency. And we've got two really strong advocates in our organization, and that's why we need to support them however we can. And so that brings us, unless any of you have any comments or questions on what I've mentioned, I'm going to talk a little bit about the endorsement process. And did you want to start out on that, Teresa, and give your thoughts on, you know, maybe why we're doing it, and
Sure.
we can talk a little bit about the process also, or?
I think on this call, besides Mark, is there anyone in Congressional District 29? No one else has Cardenas, right? Yeah. Okay. We're the closest group, and we have a couple, a few members that are in Congressional District 29. And so what we're doing is we're going to be sending the PDA questionnaire, and it's about 20 pages or so, I can't remember exactly, but it's got really good questions, specific bills. Do you support them? And if you don't, why not? So it gives a person the ability to say yes or no, and then explain why they do or don't. So, and they're really good bills, and I didn't even know about some of them. So those will be sent to Tony Cardenas and his campaign manager, and then to his opponent, who's also a Democrat, and she is Angelica, I just don't blank, Angelica Duenas.
Duenas.
One of those senior moments. Sorry about that. Anyway, so they'll be getting them, and I contacted her today, so she's looking forward to doing the process. We're thinking Cardenas probably won't bother to send the questionnaire back, but we're trying to be fair because he's also a Democrat. And so we'll see who gets the questionnaires back to us, what their answers are. Those will be posted online. Then we'll have a meeting, either one of the regular meetings or maybe a special one just for CD 29. And either the candidate or their rep will come and answer questions, you know, give a little speech. And then the people in only that district will be contacted by PDA National and will be able to vote on who they want to endorse. So the only one on this call that will be able to vote on it is Mark, and I know how he's voting.
But they're gonna send it out to, because PDA National. See, in order to do an endorsement in CD 29, we need to have 15 activists either on the national or our local list. And we checked with Dan O'Neill, and he says we do have 15, and they have to have been on the list for
2 months,
60 days. So they will send out the ballots to them. We'll have them send in. They'll send out notification to those people. So there should be. They say we have more than 15. So hopefully those people will vote, and maybe we'll get them to attend the meeting as well. And just a little. Go on.
Oh, if they aren't able to attend the meeting, they can look at the questionnaire online. We might even post the meeting online, depending on, you know, our technical ability.
And then after we have,
I want to say a few words on that question. I'm on the GIPSIV endorsement committee, and we're pondering whether we can take this up again, because the last time we were voting against Cardenas, there was quite a bit of commotion in the meeting, and the logic behind our taking it up again is that they are the two Democrats that are now running on the ticket. At the time that we had discussed it, only Cardenas seemed to be a viable candidate. So I think if other organizations expressed a desire to take a stand on this issue, it would prompt DIPSIF to take a stand.
Yeah, I don't even think, I think one of the reasons DIPSIF held up, as I recall, was Angelica hadn't filed yet, and you wanted to wait until she filed so you could, so you knew that it was official and you could um, uh, interview her also.
I think we had interviewed her. The argument was we don't try to unseat someone has been voted in.
I thought it was because we were discriminating against him because he was Latino, which was ridiculous. You know.
I mean, it was a very unfair decision.
Yeah.
And that's why we're considering taking it up again.
Well, Leah, North Valley Democrats have already endorsed her. They endorsed her in the primary, or we endorsed her in the primary for North Valley.
Yeah.
So,
I mean, one of the reasons, just a little bit of background, as you've probably all surmised from the comments and prior discussions, is, you know, Cardenas is just so non-responsive, and he's not, first of all, he's not showing up as good on the issues that are important to PDA and to progressives, number one. And number two, you know, his office just doesn't seem to know what's going on, and they're non-responsive. You know, Mark calls them East Valley Indivisibles, has trouble getting to see him. And so Angelica, you know, what we gather, and we'll confirm it, I'm sure, with the questionnaire, is in line with the progressive values of PDA. So we want to get someone in there that not only shares our values, but hopefully will be responsive. Yes. And then just to kind of add on to what Teresa had mentioned, as I recall, and Teresa, correct me if I'm wrong, as Teresa said, once the questionnaires are completed, they'll be posted online, and notification will be put out to the people on the that qualify to vote, and they can look at it online. Hopefully they'll attend the endorsement meeting, which right now we're thinking will probably be in July, because we need a little time to get it all together, and there's certain notification requirements of the candidates and also of the people that are going to vote. I'm not going to go into the specifics of them, but Teresa and I will work, you know, all of that out. And then I believe after the endorsement meeting, I think there's a period of 72 hours that people can vote. And I think that they can go, I think I mentioned sending out ballots, but I think they'll be notified and they can vote online, I think it's the way.
Yeah, it'll just be an online thing. And National is going to take care of a lot of it. They're going to send out the questionnaires. We just have to get the addresses. And if anybody wants to ask a question, I was thinking of adding something about the COVID-19 situation. If you want to ask a question specifically to Cardenas and Angelica, let us know what questions, and there's a space where we can add a couple of our own questions. So if you have anything, especially Mark, if you have anything you want to ask about, that would be good.
Sorry, I had to check out for a moment. My nurse came in, and we had medical issues to deal with.
Oh no!
All right.
But what I wanted to say, along with what Mike was saying, is that I'm on the newly formed AFM Local 47 PAC. And we sort of worked hard and convinced people to actually get Local 47 to endorse Bernie Sanders. And because the two, like what you were saying, Mike, the two most important issues mentioned other than union work for musicians is Medicare, improved Medicare for all, and the climate emergency. And so I'm working with Jefferson Kemper. I contacted him back in April because nobody's meeting at the Union Hall anymore. So we need to set up like some Zoom meetings with the Political Action Committee. And I said, you know, even in the last meeting that we had where we decided to try to get the executive board to endorse Bernie, I mentioned Angelica and how she was a Bernie rep, and given the 1.5 year experience I've had with trying to get Cardenas to respond to anything,
Yeah,
that she seemed like a much better choice to me, even though she's quote unquote inexperienced. The experienced guy isn't like really making my socks go up and down. So
right, right. Yeah, yeah, no, I mean, we don't have to get into it about Angelica, but the point is, she's where we stand, and in our view, Cardenas is so non-responsive that if we can get someone else in there, that would be great. So that's what we're looking towards. But we do have to be fair. We may not even get a contact information. I'm going to have to try to call Cardenas's office and get the his political campaign contacts so that PDA National can send out the questionnaire to him. And I'm not even sure I'll even get that far, so we'll see. Anyway.
Hey, Mike.
So
that's Bill. Can I just add that that usually the formal process is before a primary, and since we had that jungle primary, right, like a top 2 runoff,
right,
that it actually probably doesn't apply, letter by letter or section by section, like it would say if you were in the primary, because now you're going to general, but it's a top 2 runoff general.
right.
So I think we can push national on that. We should push national because this is, obviously a California kind of problem because we have that type of primary. And I know that once, when it's at least a Democrat versus a Republican, it's just a mere formality at that point, getting the endorsement, to where it would just require 1 or 2 questions like, would you join the Congressional Progressive Caucus, and would you support Medicare for all, and the Green New Deal. So I think if we push Alan and Mike Fox and Nash a little bit on this, we probably don't have to go through that rigorous process.
Yeah, well, Teresa and I talked to Dan O'Neill, and he kind of went through it with us, because Russell used to do the endorsements pretty much and Teresa and I have been time limited, and this is actually, we did an endorsement for Lorraine Lundquist, which was pretty informal, but this, we've got to follow a little bit more, because that was a PDA-CA endorsement. This is
local.
This is
race.
a PDA.
Yeah.
And Dan, I was telling Dan that we thought we should give both candidates a chance, and Dan said that would be a good way of doing it too. He was recommending that too.
Yeah.
So it's probably best to do it the formal process.
Well, he apparently won't talk to Mark at all, so that maybe he's had his chance. I would suspect more than once. Since he won't talk to Mark, that disqualifies him from getting that chance ever again.
Yeah, well, look at, 1 out of 1 is more than 60%. So,
Well, North Valley is led by Richard Matthews, who's, very well known, and he can't get a hold of anybody from Cardenas's office to try and get them to come to an endorsement.
Yeah.
So,
anyway.
So we're not the only ones.
Yeah. So anyway, unless you have any more questions, and I'd like to move on to some things about PDA-CA. And as you know, we're lucky enough to have the other extraordinary activist extraordinaire with us, Mike Thaler, along with Dr. Bill, Mike is the president of PDA-CA, and Dr. Bill is one of our consultants. So we're fortunate to have them not only from the point of view of PDA, but also from the point of view of PDA-CA. And PDA-CA, you know, we're still moving along, and we are trying to do some actions. We did some actions on protecting prisoners and also detainees from COVID-19. And I can't remember the specifics. We formed an action committee for it. And, you know, we, some of the local chapters sent out letters to some of the local officials. And the main thrust in terms of protecting prisoners was to maybe, you know, release nonviolent prisoners to create more space in the prisons, and so they could do physical or social distancing, and also just do other things that would, you know, that would protect them. I don't recall whether we ever got the letter out to Newsom. Did Hemming get that letter out?
Would you like me to just go into it a little bit, Mike?
If you want to, yeah.
Yeah, I would, because what we did is we really took up the cause of detained asylum seekers. Coincidentally, well, I live very close to the border, and I live at the epicenter of where detainees are being kept in California. What we did was we asked everyone on our email list, which is several, actually it's about 15,000 people within California, to write to the governor, to their local officials or whatever, about getting the detainees that were innocent asylum seekers out, because some of them have already died from COVID. What we found was, or what we think we have found was, mind you, these are mostly private prisons, that they released their prisoners, and these are state prisoners, these are not detainees, but they released their prisoners that were nonviolent and very quietly moved the asylum seekers into that space that was freed up. So, which is just awful. And just so right now what we're doing is we're trying to work on that. There's going to be a town hall meeting that everyone is invited to next week sometime or another. So watch your emails from PDA-CA about that. You might want to join that. And that has been our thrust for the last few weeks. And we've got, all the asylum seekers theoretically have been released. We can take a little bit of credit for that anyway, if not all of it.
Yeah.
So that's what we've been up to, PDA-CA statewide.
Yeah, and on the blast, watch for the symbol that is proofread by Teresa Preem.
I said I would do it.
That's a little inside joke. I just kind of teasing Mike.
Not that inside at all. No.
Okay.
It's a volunteer.
I only look at it quickly, so don't expect a lot of.
Right, but I'm counting on you, Teresa, to make me look like less of an idiot.
Yeah, you know, just to give you a
I
quick.
complained about his editing, and so now I'm stuck with proofreading.
Yeah.
You know, it's the old story. Watch what you say, because then you'll have to do it. You know? You know. Anyway, just to give you, before I go further, a quick overview of what I'm going to talk about with PDA-CA. I'm going to talk a little bit about the leadership group. I'm going to talk a little bit about communications in our website. I'm going to mention, well, I kind of mentioned the action committee, but I'm going to mention a little bit more about that. I'm going to bring up a healthcare letter to Governor Newsom for us to sign on to, and then I'm going to ask for some input from the group of what they might want to look at at the state level or even the local level. So we have a communications director. He is supposed to help do, he's supposed to do the blast and also develop our PDA-CA's website. And like everyone, he's somewhat time limited. And I was thinking maybe if you guys know of anyone or are interested in maybe working with him and coordinating with Mike Thaler to work with him to put in some time if you're familiar with developing websites, or if you want to help send out the blasts. So maybe we can be a little bit more consistent with that. So that's a volunteer, opportunity. So if you're interested, let me know or let Mike Thaler know, and we'll put you in. We'll we'll integrate you into the system. And also, if you want to be on the action committee to help us with some of the actions that we're going to develop, you're more than welcome to, volunteer for that also. Because like with all these organizations, everyone is time limited, and getting people to actually do the work is difficult. And, I understand that. I'm as guilty of it as anyone. And, I understand why it happens. So if you're retired, if you have some free time, if you're just working part-time and you want to do some stuff, it certainly would be helpful to get involved. And that would also be if you wanted to get on the We Want Bernie calls for PDA to find out. I don't even know exactly what PDA is doing on promoting Bernie in the primaries and trying to get enough delegates to get up to the 25% level. But Mike Fox has calls twice a week, on Thursday night and on Sunday nights. And if you had the time and were interested, it would be great if you could get on those calls and find out what's happening and see what you can do. So there's opportunities there if you've got some time and you want to put some.
Hey, Mike, can I interject?
Yeah, go right ahead.
That Danette is a super volunteer with the Mike Fox crew. So she's on the phone. She's Mike Fox says jump, and she says how high.
Well, that's great. Yeah,
Gotta
and
do
if we could, and if we could get someone, because I'm sure you're overloaded, and if you not really, oh well, good, okay. And you guys
might
don't
keep
need to
you busy.
volunteer. Danette's got it covered.
I can work 14 hours a day and it's fine. So
Okay. All right. Well,
not
that's
as much
great.
not as much as Mike though.
Well, I really appreciate the work that you're doing, as well as Mike Thaler and Dr. Bill and the rest of you that are doing what you're doing. So I do appreciate that. And a couple things that, just to mention, we do have a leadership group for PDA-CA, which is composed of chapter leaders, and we're trying to get more chapters for them, just as PDA is, and also other leaders within the state that want to also get involved at the leadership level. So that's something that PDA-CA is doing. And we're PDA-CA, a couple things. Teresa and I for the chapter are always, and Teresa always seems to come up with something, so kudos to her. But if you have some suggestions for speakers for our PDA meeting, for our chapter meetings, let us know and we'll see what we can do. And then as far as PDA-CA is concerned, we're looking for action items that we could do with the state and local levels. So if you have any suggestions, even now on PDA-CA, if you have something at the state level you want to mention, as long as Dr. Bill and Mike are here and you want to mention it, and give us some ideas as to what you want to do. And then we could see what we could do about getting the action committee or PDA-CA to work on it. So,
hey, Mike, can I mention that there's also coalition groups working across the state still on single payers. So, when they blocked it in Sacramento this last time, the speaker, Anthony Rendon, would not allow it to be heard on the assembly side. It was passed by the Senate. And there's even a group, like an ad hoc group right now, that's pushing Governor Newsom to unshelve the bill. Anthony Rendon shelved the bill. And so there's a group of us even pushing Newsom to unshelve the single payer healthcare bill for California. So that's a big deal.
Yeah, that was the letter I was going to talk about. I think that's the Healthy California Now bill.
Oh, right.
I mean, a letter. Yeah. And they've written a letter to Governor Newsom, you know, asking him to reopen an expiration for doing single payer in California. And they go into the reasons for it, and they're asking him to reorganize or establish a Healthy California for All commission to move towards progress on you know, single payer in the healthcare system in California. And I think PDA-CA is going to sign on to it as a state organization, and some of our individual chapters are going to sign on to it. And so I'm wondering if, unless there's any objections, I thought maybe, because the individual PDA-CA chapters could sign on to it as well. And unless there's any objections, I thought maybe our chapter could add our name to it as well. So
I believe he ran on this issue too. I mean, it's not something that is foreign to him.
Right.
Yeah. Just a little more compelling is that when the speaker shelved the bill in the last session, they made a concession to form this commission that would look at recognizing the fact that it was an incredibly popular idea, like 85% of Democrats in California or more wanted a single payer system. So they acknowledged that by forming a commission, because in the last session, they had another commission that was looking at, okay, how do we get universal health care in California? They concluded the only way to get it really is to have a single payer system. So now it was came out of the last session that we now have a commission looking at how we get a single payer system. And that's what the new commission is. The commission right now is stalled because apparently because of the pandemic. They were supposed to have a meeting in April, it never happened. So now we don't know when they're going to have the next meeting. So what we're trying to do is just tell the governor, push the commission to meet again, you know, because we need them to continue their work to get the single payer system going now. Yeah. So that's where we're at. That's different than telling them to unshelve the bill and have the SB 562 heard again. It's simply to tell him you need to get the commission to meet so that they can do the work that they said they would, so that by the end of 2020, when we know what federal government we're going to have, then we'll know what California can or can't do to go forward with its own system. Because that was the other excuse. Remember, I mentioned they said that they said we couldn't have it in California because the federal government wouldn't go along with it. So when we know what federal government we end up having by 2021, we want the commission to say, okay, this is what we do then to move ahead now.
Right, and that also kind of ties into Ro Khanna's bill, trying to lift that more quickly. Well, great, that's terrific. I'm glad you put some meat on my presentation, because I was giving a very sketchy overview of it.
No,
obviously,
you're
you're much more familiar with it than I am.
A little bit.
So that's good. So, I mean, I think it would be good if we could sign on as a chapter. Isn't that what we thought we wanted to do, Mike, as the individual chapters? Mike Thaler, isn't that we would want the individual chapters to sign on to it? I think a couple of them already did.
Yeah, I think we want to do both.
Yeah, so
PDA-CA in general. Remember that the vast majority of PDA/PDA-CA members in California are not in a chapter. So
Right.
it can represent those.
Yeah. So do we want to take a vote, or do we just want to say, okay, we'll just do it? I mean, if we vote, there's 13 participants, and you can go there and raise your hand, and the host could count the number of raised hands or something.
I think if you go to participants, you should see a yes or a no. If you push participants,
I'm sorry, say that again?
I'll say it.
or we can
for
just
her.
do it, or we could do it informally. Do we really need to take a vote? It's pretty much what we do.
Yeah, I mean, this is one of the key policies of PDA. So,
So if
and
there's no
PDA-CA,
objection,
yeah.
why don't we go with it? If there's an objection, we'll take a vote. Any objections?
Oh, I vote yes.
Okay.
I can't see me because my camera is looking backwards, and I'm
Oh, I was
afraid
trying to figure out what it was looking at.
because I might not get back to you. So you lost my picture, but you got everything that's behind.
We
the
can hear
picture.
you loud and clear though, so yeah.
But I'm
Let's
speaking.
do it low tech.
Okay.
Put your
go on.
thumb up if you want to do a yes vote. That way we don't
Yeah,
have
you
to
can't see me.
try to figure out where the.
Okay.
Okay, well, we've got,
Good.
okay. Carrie and Alyssa and
Thank you,
Leah, are
Carrie.
you okay with it? You guys are muted.
Yeah, you're all muted.
Yes.
Okay,
My
Leah's
voting-
good.
Majority even without them.
Yeah, that's true. All right, sounds good.
All right, Leah, you're unmuted. Are you okay with going with,
Mute. I said yes.
oh, okay. Okay. And Carrie, you're unmuted now.
Yeah, we're a bit confused as to what we're voting for.
The letter to Governor Newsom that Dr. Bill just explained to open up the Healthcare Commission to
Okay.
look at
So
single payer in California.
we're asking to open up the commission, and I agree with that. Yes.
Yeah.
So
Okay.
does Alyssa.
All right. Well, all right. So we've got a majority. So I think that we could do it.
All right.
Mike,
I think it was unanimous from our members.
so Mike Thaler, do you know? Well, you and I can talk about how we do that, I guess, just to get our name on there. I'm not sure how we do it.
Larry, you're muted. Okay.
Where's Larry? There he is. Yeah.
Well, that concludes the agenda. I mean, if we want to talk about how we're all doing and complain about what's going on, we can do that, or we could adjourn,
Let's socialize. How's
What?
everybody doing? What have you learned about yourself through this experience? And what have you learned about our government through this experience? Are you working? Did you want to be working? Those kind of things.
First of all, you all look like you're healthy except for Mark, and hopefully,
Surely we can't.
Mark looks too good to be in a
I'm going to say
hospital bed.
goodbye because
Yeah.
I want to turn my camera around. Okay.
Okay.
It was great
All right.
seeing all of you, and I hope we have another meeting soon. Okay.
All right.
Bye now.
Thanks, Shirley.
Hi.
Harry and Alyssa wish you health and happiness, and we'll see you again soon.
Stay
All right,
safe.
sounds
thank
good.
you, and back to you guys. And anyway, and remember, think about some issues and some speakers, and let
Okay.
Teresa or I know.
And Carrie, I'm still
Ta-ta.
vegan. Still
Thank you.
vegan.
Good to see everyone.
Bye-bye. See you later, Bruce, Diane.
Carrie and Alyssa, still vegan.
Bye, Teresa.
Bye-bye.
Did you just say go vegan?
That's what
Vegan.
Carrie is still vegan.
If I can do it, anyone can do it.
And I also want to thank you all for joining the meeting, and again, thank Dr. Bill for his presentation, and thank Mike for his setting up the Zoom meeting.
Thank you.
So, and of course, I always thank Teresa, because without her, none of this would happen. So,
Thank you, Teresa.
Thank you.
yeah.
All right, well,
Okay.
And
Teresa,
Carolyn is
it's,
still
you
vegan.
can take it over if you want to talk about anything more, if you want to close it out, whatever you think.
oh, okay. Mike, you can turn off the recording, or am I doing that?